Hi everyone, my name is Vitek, and I'm good apparently. I am a current MPH student, and my background is in nursing. I've worked for a nurse for about 5 years, and primarily in the pediatric emergency room setting, and most of my experience is in the District of Columbia. So today we're going to talk a little bit about the future of our healthcare and what I believe is the secret to changing it. So we're going to do a little bit of role play here, more of a scenario. We're going to take a trip to the ER. And so you're going to imagine that you're a parent and you have a child, and you've brought your child into the emergency room, and I happen to be sitting at the triage desk, and I say, well, hello, I'm Nurse Megan. What has brought you and your child in today? And so here is a list of some of the presenting illnesses that you would expect to hear. You know, I fell from the balcony, I broke my wrist, drank the 409, or my baby won't wake up. That's a scary one. But most likely what you would actually hear is that, well, my child has a cough, they have a bug bite, or they have an itchy scalp. Unfortunately, these are what we would call low acuity concerns, and they make up about 60 to 70% of daily emergency room visits. Now, unfortunately, it's not just presenting illnesses that people come in with. It's also presenting social illnesses. Now, so I live and work in DC, and it's often known for its power and prestige. But DC, just like any other city, has its own issues that go into transgenerational cycles of poverty and pain, which translate into poor educational attainment, single motherhood, and low socioeconomic status. Unfortunately, in ER, we don't have time to deal with these issues. And so as a result, after about a couple of years of working in the emergency room, I was frustrated, and I felt that I was unable to affect change in the lives of these families. I realized that my families and the patients were not just experiencing monetary or social poverty, but they were also experiencing a poverty of adequate and appropriate health care. So after about 2.5 years, I was burned out, and I left the country. It's a little dramatic, but thankfully I ended up here, which is Guatemala. It's a beautiful country, and I ended up volunteering in an orphanage where I got to know some of these faces. I lived with them, and I realized here, while being in Guatemala, the importance of primary care relationships. And I also realized that some of the frustration I had felt in the hospital was really as a result of this truth, that our healthcare system has its priorities reversed. And so what do I mean by that? I mean that often our hospital medical model focuses on power and prestige. It's seen in the monetary incentives that cause people to pursue specialized medicine, and it also is seen in beautiful, sprawling campuses that don't quite look like the primary care clinic down the street. And so in many of these ways, we often focus on the hospital medical model instead of the primary care physicians, and we don't encourage people to go into that area. And so this is great if you need to be rapidly resuscitated, or you have cancer, or you need chemo, or something like that. But what happens if you simply are sick, and or your child is sick, and in order to take them back to school, you have to have a doctor's note? Does that mean that then you have to call out of work the next day in order to take them to the doctor? Does our current system give you any other option other than doing that? The answer is no. The only reliable solution is that you do have to call out, and you end up going to the emergency room or to many of the minute clinics in the area. And so while this may be a fast and easy solution, it comes with its own price tag, literally. So an ER visit is about $850. If you were to go to the clinic for the same visit, it's $250. Different, simple math is $500. And then if you look at the about 1,000 visits per month that are low acuity visits to the emergency room, we get almost $500,000 in wasted Medicaid spending or healthcare spending each month. And this is just an example of my hospital alone. And so whether you're a private payer or you are covered by Medicaid, eventually the unnecessary price burden for immediate healthcare takes its toll. In particular, the New England Healthcare Institute in 2007 noted that the emergency room overuse represents about $38 billion in wasteful spending each year. This is a huge number. And as Medicaid is already beginning to tighten its reimbursement, eventually the money that's going to the hospitals will decline. And as our government currently debates how to not jump off the fiscal cliff, we have to wonder if we're already doing the same with our healthcare. So, what do we do? In our healthcare, we have all of our training expertise, and it's supposed to help us do one thing: fix people. But so how do we fix this problem of broken societies, broken families, and broken healthcare systems? So I have an answer. My answer is that we send them home, not back to their place of residence, but instead we send them to their medical home. A medical home is defined as a place where you can go get cross referrals, where you can be hooked up with social services, where most importantly, you have a medical practice to go to that fosters meaningful relationships with its patients. According to the Affordable Care Act, these are some of the things that the medical home is supposed to provide. And so here's what I think should be a part of the solution in order to fix this problem. Number one, we need to prioritize. We must prioritize our medical homes. We must make sure that the faces of our providers are consistent. We need adequate staffing and flexible hours for appointments and walk-ins. We also need to educate. We must educate our patients and families on how, when, and why it is appropriate to use healthcare and the healthcare system. And then we also must inspire. We must inspire them with a reason to go to their medical home. We must inspire them to take ownership over their own health. And we must incentivize appropriate healthcare seeking by giving them a real home to visit. So what I'm going to end with is that I feel that in order to effect change on our system, we must begin to view our families and patients as the future of our healthcare. The answer is not necessarily money and prestige, but instead we must continue to invest in our primary care providers. It's time that we care for our patients the right way, and it's time that we invite them to our home. Thanks.